Okay, so we've got this patient who has a hypomobile left TMJ, and the right one's moving a little bit better. Let me turn my music off. There you go. So my goal is to try to get this jaw to working more. So an outside release externally is just to come in right where the mandible is to distract her. And then you can also do side to side, right to left motion. So one of the home exercises is the patient comes in with their thumbs behind their mandible, the thenar eminence down on the jaw, they pull down and out. Another home exercise program for hypomobility is sticking tongue depressors in your mouth. Certainly in Barbara's case, she's hypomobile on this left side, so C2 is rotated to the right, and she has a restriction in her OA segment at all. So a lot of soft tissue stretching the SCM. An internal release for the pterygoid, take your middle or your index finger, I palpate on the exterior part of the jaw, and I go in and palpate the pterygoids, and actually if you don't even know where they are, you can loosen up everything around the jaw. So I'm taking my middle finger and I'm pushing laterally, and then I'm also pushing down to the floor a little bit to let that release. And so what I'll do is I'll hold it, and you'll feel it relax, and then you just kind of move with it. So an internal pterygoid release is great. Something I really like to do, sit up, Lisa Lou, is they need to be sitting in a chair, but we're not. And I'm sticking my hands in your mouth after I play with this, but whatever. Okay, so it's when you come in and you grab hold of the back of the mandible with these two fingers. And so I've got my thumbs here. Relax your jaw. Okay, they're sitting up nice and tall. You don't want a forward head posture. And I pull down with my thumbs to try to loosen this. And you'll feel if one side is tighter than the other, like hers is, the left is tighter, you're actually going to pull down on the left one longer. And then you can also do a segmental move where you get in here, and I usually am on the side while she's in her chair, and I grab the lower part of the jaw, and I can do a distraction or I can do a side gliding. That works really well. When she opens her jaw, she deviates to the left, good job. Give me a left deviation. There it is. That means these muscles here need to be strengthened. So open halfway. There you go. Now push your jaw easy to the right. But what you do is you teach the patient how to do an isometric with their hand. So open halfway in front of a mirror, and then push to the right, but make sure you don't really actually go to the right. Okay? There it is. Peace out. Come